nurses are involved in their care, then we can help prevent any errors which may occur, and this is especially the case for medicines. We want you to be telling us about all the information that you have about your medicines and your medical history, which might affect the medicines that you are prescribed. We know that most people who come into the emergency department receive at least one dose of medicine, be that in tablet or injection form. And we're really happy for you to ask the staff what it is that you're receiving and what the medicine is for. So please ask if we don't tell you. It's really important that you bring your medicines into hospital if at all you can, and even if it requires one of your family members to go home and get your medicines to bring into hospital. The reason why it's important to bring your medicines into hospital is because we might not have all of the medications that you're on, and we don't necessarily want to miss out on you having doses of those medicines. Also, if you bring in your medicines to hospital, it can help us identify exactly what you were taking at home. When you bring your medicines into hospital, we will make sure that we store them securely away to make sure that they are as safe as possible for yourself and for all of the other patients in the hospital. So we'll put your medicine into a green bag and we will store the medicine away securely. So don't be concerned if you can't see your tablets at all times. Okay. If you have any controlled drugs, for example, morphine or diazepam or Valium, it's important that you let the nursing staff know that you've got those particular medicines. We need to store those very securely. There's extra precautions that we need to take. Also very important to bring into hospital is a list of your medications. Bringing that medicine list into hospital makes our job a lot easier and can help identify if there are any issues with your medicines that we might need to change. In terms of information that we can give you about medicines, we're very happy for you to ask our staff that can give you some verbal information about the tablets or the injections that you're receiving while in hospital. If we start any new medicine, we should be giving you some written information about the medicine that you're receiving, and also write down a list of any changes that we've made to your medicine to give to you before you go home. So every time we administer the medication to you, it's important that we follow a process. So we will double check with your armband exactly who you are, and we will double check whether you have allergies to any medicines. We also should check with you the medicine that we're giving to you. So when you come into hospital, it's really important that you give us information about allergies. We don't want to be giving you medicines that you might have had an allergic reaction to in the past. And this can include a rash or a wheeze or difficulty breathing, anaphylaxis. We need to know that information. We need to know what the medicine was called, what the reaction was, and when you had this reaction. We will make sure that we document this reaction, and we will also check with you every time we give you a medicine about your previous allergies. So when you tell us about the allergies that you've had to any medicines, it's really important that we can identify this easily to all of our staff. We will probably put a red armband on your arm, and that needs to stay in place during your hospital stay. When we give you a medicine, we will also check if you've had a red armband, what allergy it is that you've had to any medications. So we might ask this several times. It's important that you let us know each time. It's also really important for you to tell us about any medical conditions that might affect the way of the type of medicine that we prescribe or the doses that we prescribe. For instance, pregnancy or breastfeeding, or kidney or liver problems. Also, let us know about the tablets that you've had just before you come into hospital. For instance, pain relief tablets or EpiPens, or if you're on any blood thinners, we'd like to know that as well. So in terms of medication safety, we're trying to keep you as safe as possible, just with making sure that you tell us all the information that we need to know, and we will double check with you about the medicines that we're giving you and whether you have any allergies to them. We will store your medicines safely as well when they're brought into hospital. Thanks.